And the majority of them had no idea what disease they had. Hi folks, this is Dr. Rob Cyrus. I am the Carb Addiction Doc. And we see thousands of patients and we do thousands of lab tests on those patients. I am a clinically practicing doctor, even though I'm flapping my gums on the internet right now. What I'm talking about is based on what we see in our office. And one of the interesting things, and it's statistically higher in women than it is in men. It's statistically significant, but when we analyzed our last 1,000 patients, right at 82% of my female patients that came to see me, now pre-selected, this is not a spectrum of our society, but 82% of them were being treated for thyroid disease. 82% of them were on medication for thyroid disease. And the majority of them had no idea what disease they had. And I said, okay, you're on Thyroid, or oh, you're on Cytomel. Why? Why? Well, some of them had surgery, some of them had a diagnosis, most of them, oh, because my numbers were low. Folks, that's not a diagnosis. That's an observation. That's hypothyroidism. But it's an observation. Why are you hypothyroid? You're not taking enough iodine, you got Hashimoto's disease? Why? What's the problem? Because the problem might be reversible. But every one of those people, mostly the women, have been put on a medication for the rest of their lives without the doctor ever knowing why. And the worst ones are the ones where the doctor said, well, you come in, you're a little obese, we're going to boost your metabolism. We're going to put you on some thyroid hormone, boost your metabolism, get you to burn it off. And of course they lose a bit of weight because you're jump-starting them for a little while. But look at the damage that does throughout their hormonal system. Because every hormone is interconnected with every other hormone. But they don't look at it that way. They want to see instant results right now.